very much. It's a pleasure to be here. And I want to thank Janesville for being a stop on my way to Illinois in the spring of 2011. And if you do have playing cards for the Wisconsin 14, you have to have a playing card for my sister, Doug, and my brother-in-law, Doug, and my sister, Kelly, because in a small Culver's in Freeport, Illinois at 10:30 at night, they said to 12 weary travelers, "Do you know where you're going to stay tonight?" And those 12 weary travelers said, "No, we really don't." And she said, "You know, I'm a psychologist, and I look at you and I think under Illinois' political refugee classification, you probably would be eligible for services, so maybe you should stay at my house." And my sister opened her door to almost all, not quite all, because a few of them had relatives down in Illinois besides me, and opened her door, and Chris Larson, the current minority leader, slept on my sister's floor in the basement until the Border Patrol of the teabaggers in both Beloit and Rockford together scoured the area and finally figured out a week later that the teabag guy that lived across the street and had been watching my sister's house with a telescope, not binoculars, but a telescope, finally figured out 1 week later, after there had been, 12 cars with Wisconsin license plates, and my good friend Leah Taylor, who's not the same color I am, coming and going, figured out that the Wisconsin 14 was right under their nose. And when they found it out, they wrote about it in all their blogs. So if you ever want to look at the history of the Wisconsin 14, it is on the blogosphere and the teabaggers, all the teabag people's, all their little websites. So thank you very much. I'm glad to be here. I'm here to talk about healthcare.
You have a place to stay tonight?
Thank you. I love Janesville. I'm here to talk about healthcare. Healthcare is a topic that is so near and dear to me. It is what motivated me to run for the Wisconsin State Senate. As Chuck just told you, I was an uninsured dairy farmer when I ran for the state senate. I also had a PhD in health services from the School of Public Health at St. Louis University and had a master's degree in public health. And actually, although this sounds odd, in my county, there are 2 dairy farm families where both spouses, full-time dairy farm families, where both spouses have a PhD. So there's Buffalo County for you. Don't you ever think that those rural people aren't educated. Although I will say, in my neighborhood, my PhD is a little bit of a liability. So I don't talk about it very much unless I'm far away from home. But this is the reason why I ran for the Senate. In the first 6 months of the Senate, when I was a senator, in the spring of 2007, the Democrats had control of the Senate, but not the Assembly. I and Senator Urbanbach and Senator Miller, both from Madison, together crafted a bill that became Healthy Wisconsin. You will recall that bill because we, especially me, was accused of being the queen of the $15 billion tax increase in the next campaign. But what they didn't tell you is that we eliminated, let me say it one more time, eliminated health insurance premiums. They were gone, totally gone. Think about that. For $15 billion, we bought health insurance for every man, woman, and child in the state of Wisconsin. We figured it out in the spring of 2007. Now in 2009, of course, the short end of that happened with my good friend Judy Robson, your senator, who tried very, very hard to get this passed. She made a very bold decision in a quiet room on the 2nd floor of the Capitol when we presented her our plan and we said, "What do you think?"
And she hesitated for a minute, and I thought 6 months' worth of work was going to go up in smoke. And she said very quietly, after everybody had argued their point, she said very quietly, "It will go in the budget." And then she walked out the door and into the room of press. And it just gives me shivers to remember that, because it was her boldness and her foresight that forced the issue of health care for all in the summer of 2007 before anybody at the state level or at the national level was talking about something as bold as what happened when the president finally passed the Affordable Care Act. And you and I both know that the Affordable Care Act is not exactly where we wanted to go. We wanted a public option. We wanted those insurance companies to have a real reason, a real force to bring down costs. And of course, a lot of us said, you know, insurance, well, like Chuck said, where's Chuck? Like Chuck said, insurance, healthcare, not thinking this goes together. So what happened after that? In 2009, I drafted 6 different bills. Almost all of them were then picked up by Governor Doyle and put in the budget, which sometimes happens when you have a good idea. You know, the old saying, Harry Truman said, if you don't care who gets credit, it's amazing what you can get done. So at that time, one of the bills I drafted, for example, was to allow adult children, be carried on their parents' plan until age 27. Now, this was in the spring of 2009. This actually became law in July of 2009. You'll recall that Obama passed and Congress passed the plan of the Affordable Care Act in 2010. The whole time that Affordable Care Act was being written, I was watching it very closely. In fact, I read the bill through twice to make sure that the draft I had creating a Wisconsin-based exchange, hello and welcome, the draft I had was going to be completely implementable or under the federal rules, meaning everything was consistent at the federal level and the state level. So in the spring of 2010, I introduced the first Wisconsin exchange. And then the summer of 2010, the rules came out, I rewrote the bill and then introduced it again when I got back from Illinois in the late summer of 2011. So twice, actually 3 times if you count Healthy Wisconsin, I've introduced a bill that would bring health care, affordable health care to people here in Wisconsin. A little footnote on that whole story, when the Republicans took over in 2011, all the changes that I made, including the let your child stay on your health insurance until age 27, they repealed all those laws. Yeah, so it used to be that we had a better law here in Wisconsin than at the federal level, but now we're back to the federal law. So the article that I wrote about, that Chuck asked me to come and talk tonight about, is the bill that I wrote that's now called Senate Bill 273. It's actually going to have a new number in the new legislative session, but it creates a Wisconsin-based exchange. And there's a lot of discussion among progressives about whether or not this is indeed a good idea. I talked with Senator Cullen, your senator, yesterday about this idea, and he said, you know, I keep thinking Secretary Smith, Kathleen Sebelius, Secretary Smith, Kathleen Sebelius, and of course Secretary Smith is our Secretary of the Department of Health up in Madison. He said, I'm thinking that I really trust Kathleen Sebelius, which is Secretary of Health and Human Services under Barack Obama. I trust Barack Obama's administration better than I trust Governor Walker's administration to administer this new exchange. And I said, you know, Senator Cullen, I agree with you, except if I would look at this bill that I've written, this bill would put into law some things that the governor definitely doesn't want to do. And I'm under no illusion that the governor is going to pass my bill, but the reason why I'm putting it out there is because I strongly, strongly feel that we have the resources here in Wisconsin, if we had a governor that had the will to do it, to create a much stronger exchange than what we would have at the federal level. Now, I have a handout. I'm not going to give it to you right away, but it's here for you to take home. It describes the exchange and why it's a good idea, but let me give you just a 3-minute overview of it. An exchange is kind of like a single place on the internet where you can go to buy a health care package. And you could also have your insurance agent help you through this process. But the idea behind that little place on the internet is to bring as much competition to some type of industry that if you bought health insurance, you know has a whole lot of fine print, and it's really, really hard to figure out how you compare that one fine print package to another fine print package to another fine print package. Because basically what this does is take away all the fine print and say, boy, if you're going to be part of us playing on this field, you got to meet all these rules. And that's what it does. That's what it does. And those rules are things like you can't hold pre-existing conditions against somebody. You can't charge more money for women than men. You can't hold the fact that somebody has it's going to have a lot of care, you know, like they're diabetic. That's a pre-existing condition, but also lifetime limits. You can't hold that against. You can't say you've met your lifetime limit, we're not going to cover you anymore. And you have to take everybody who comes in the door. And this is part of the problem with insurance companies right now. So in Wisconsin, we have 2 different organizations that have operated for almost 10 years that have been kind of a melting of the insurance industry and the health providers, the hospitals and doctors, and they've collected claims information, and they say that they post this claims information so the businesses can tell who's good and who's not, or who's good quality and low cost. But honestly, the information is very hard to understand. So my thought was, why not make this as transparent as possible? And say I was hiring somebody who had diabetes, and I was a small business person and wanted to find coverage for my 5 people, and I knew one of them had diabetes. I could go to the internet, put in the word diabetes, and then have the plans ranked on how well they took care of my previous patients with diabetes. How were they ranked? And this is something that if you were going to go to Consumer Report and buy a car, you'd have information on the reliability of that car. You would have information not only on the cost of every single option, but what the owners of that car thought about the car and how well that car performed for the past 3 or 4 or 5 years. That's the kind of information we need on health plans. When the health plans say they're competitive, they're not really competitive because they have all the power to write all the rules, and all you have is a bunch of fine print, and you have no bargaining power with that health plan. So in the short version, what this idea of the exchange is supposed to do is use what they call managed competition, meaning the government's playing the job of the referee and calling the fouls on those companies that aren't following the rules. Use competition to drive down costs. It's no accident that the first time this idea came forward in 1993 against the Clinton administration, this idea first came forward from a Republican think tank called the Heritage Foundation. But think about this, how Obamacare has been distorted for political purposes. And we've moved not, what's right for you, this is my left, we've moved not to the center, not even to the near right, we've moved to the far right because the far right has moved so far we can't even see them. That's what's happened. So, I'm going to give you my handout and you're going to know that this bill exists. But I want to also share my vision, what I see. I imagine healthcare reform as the ocean. It's there. I can see the ocean, but it's pretty far away. And there's a stream in front of us, and there's a lot of boulders in that stream, but there's definitely, if we can get around those boulders, a path to that ocean. There is a path to healthcare for all, and I can see that path. And part of the way that we can do this, you talked about Chuck Vermont, part of the way that we can do this is in the Affordable Care Act, commonly called Obamacare. there is a provision that by 2017, not that far away, states can decide that the exchange can be opened up to anyone, not just limited to businesses. In my bill, I limit it to businesses under 100, because I want to open it up as far as I can under the law. But states can choose to limit it only to businesses and people who buy insurance on their own, like farmers, up to 50 employees. But I decided to make it as large as possible. So if you have 100 employees, you can be part of the exchange. Well, think about this. We need school districts. We need local employees that work for the city of Janesville. We need large companies. We need as many people as possible to be part of the exchange. Because when that happens, the bigger the pool, the lower the cost. And that's the philosophy of this. The bigger the pool, the lower the cost. It's exactly what happens in the province of Saskatchewan, which was the beginning of the Canadian system. I mean, they began to think in a much bigger way than we have for years. So I do believe that Vermont is on the right track, and I do believe that there's a path. But I have to say, we have to be patient. And the first thing we need is a new government.
Yes.
I know there were some questions about mining and sand mining, so if you don't mind, before I ask for your questions, I want to talk a little bit about mining and sand mining. And then I'm going to ask you for any questions that you have. So get your questions in your mind. I spent yesterday all day in caucus with my Democratic colleagues in the Senate. And I have read a lot about mining. I read the original bill that came out of the Assembly. And I learned more in 15 minutes listening to your senator, Senator Cullen, than I learned in all of the time I spent reading the bill and all of the time I spent reading the newspaper articles about it. So you do have right here in Janesville the smartest, one of the 2 or 3 smartest guys in the state on this issue. And I'm going to share what he told me. So this is Senator Cullen speaking. God put too much water in northern Wisconsin to make iron ore mining work. That's what he said. And the deposit is at an angle rather than straight down, which means that the mining company would have to cut a V shape rather than straight down. That means a tremendous amount of, I forget what the mining word is, there's a word for waste, but a tremendous amount of waste, basically soil and rock.
Overburden.
That's it. Overburden. Overburden. That means soil. Topsoil that grows plants. Overburden. So there's so much dirt and stuff that would come out of that mine that's not iron ore, that the amount of iron ore that they would take is 20% of the total volume that they would have to take out. Which means that they would have a lot of stuff they'd have to deal with. Now, he listed all the waters, and I remember 2 lakes and 2 major rivers and like 25 trout streams, and then a whole bunch of swamps, which are what we call wetlands. And then they would have to take out this dirt, they'd have to put it somewhere, it would have acid in it. The water from the mine would go into the Bad River. The Bad River travels through the Bad River Band of the Lake Superior Chippewa, who have their own water rules on safe drinking water. And then it would go into Lake Superior, which also feeds into Lake Michigan, which many people draw their water from. And he said, Wisconsin is not the only player in this game. The Corps of Engineers has to sign off. And if the Corps of Engineers thinks the state law is working with them, they they will work very hard with the state. But if they think the state law has gone too far, they will drag their feet. And 4 years could turn into 6 years, which could turn into 9 years, which could turn into 19 years. So we've got litigation from the Baton River tribe when the effluent may travel through their wetlands and their rice fields and their own tribe, which has its own water, their own tribal reservation lands. We've got the Army Corps of Engineers, which has to sign off on it, and we've got something called the Great Lakes Compact, which regulates water flowing into and out of the Great Lakes, which is a compact agreement that is not only among the governors of the Upper Midwest, but also among some certain Canadian provinces. It's an interstate agreement. So in the most recent Chamber of Commerce up in Eau Claire, I was asked about the mining, and I said we must be very careful because if we do not do this right, it's going to end up in court for a very long time and there will be no jobs created. I had no idea until I listened to Senator Cullen how right I was. So in some people's mind, they're saying let's have the worst possible mining bill because there's no way it's ever going to pass. It's going to end up for sure in court, and the mining jobs aren't going to be there. So now I'm hearing that perhaps this whole thing is a smokescreen, so the governor can run in 2014 and say, it's the Obama administration that's tying this all up, and it's all his fault that I don't have any mining jobs yet. So, there you go. That's your 5-minute mining briefing from my 15-minute briefing from Senator Cullen. And I do want to talk a little bit about sand mines, because sand mines is something that's not necessarily on your radar screen, but it has consumed more of my time than anything else in the last 2 years. I live at the epicenter of sand mines in the state of Wisconsin. I have 5 or 6 counties, and we have about, I'm going to say about 20 operating mines, but many, many, many more are pending. In just one county, the county of Trempealeau, there are at least 100 permits pending on sand mines. Now, that's just one county. In the state of Wisconsin's 1,000-acre sand mines are regulated like 1-acre gravel pits. That's the way the state of Wisconsin regulates sand mines. 1,000-acre sand mines are regulated like 1-acre gravel pits. And so we have very little state law that will stop what's happening. And the sand mines, these are sand mines that many of them are front companies created by oil and gas interests in Texas. The sand mines have come into areas, looked in my neighborhood, found the townships that are unzoned, and moved very fast to set up those mines before the local people have any idea what's happening. And they have paid a lot of money. I used to represent Sparta and Toma. Between Sparta and Toma, there's now a 1,000-acre mine owned by a company named Uniman. When they came in, let me say this, land that sold in the summer of 2010 for $2,000 an acre, in the summer of 2011 sold for $24,000 an acre. $2,000 to $24,000. And it's very, very